Hello everyone. I think with the limited time we have, I will just jump direct to the topic. The topic is prevalence of intestinal parasite and its pattern of infection among malnourished children in Somalia. A topic we believe it has a great relevance on the topic on hand, which is One Health. On this session, I will cover the introduction, material methods, results, and finally the conclusion with recommendations. Intestinal parasite infection is still a preventable disease even in a developing country like ours. 443 million children is suffering from hookworm, which is a part of the intestinal parasites, and that burden heaven is mostly on sub-Saharan countries in Africa, as well as some part of Southeast and South Asia, which makes it a problem to us. 1 billion people around the world suffer from Ascaris lumbricoides. Around half of that burden falls again on children of under 5 years age. Almost a third of 750 million worldwide cases of trachea affects children as well. In Somalia, there is a very limited data about intestinal parasite infection patterns in children, as you can see from this figure, showing the white color as a no data color. And this is what motivated us to do this investigation about the frequency, pattern, and the magnitude of intestinal parasite infection among children of young age, especially those with malnutrition. Somalia has been suffering from food insecurity over the past 3 decades, and we have been one of the rarest countries being affected by floods and droughts at the same year, maybe around the same season as well, showing how neglected climate changes, environment, water availability, and health conditions are in our country, showing very little or non-existence collaboration between these factors. And this inevitably led to this cycle of unfortunate to our children. They all suffer from inadequate dietary intake. Dietary intake will lead to diminished growth and deficiency in their immune capacity, and that will lead then to serious conditions of diseases, and that unfortunately will cause again loss of appetite and reduced dietary intake. This is non-stopping cycle unless we decide to break the chain and work together to stop this unfortunate cycle that a lot of our children are suffering from. The study investigated the prevalence pattern of intestinal parasitic infection among the malnourished children, hoping that this information or this data will mitigate the challenges faced by those malnourished children and will provide strategies for the needed integrated actions and targeted interventions for those children. We hope that this information and this data will lead to some action points that support our children. The study was hospital-based cross-sectional study design of 222 children is included with the criteria of being malnourished child following the WHO anthropometric measurements. Specifically, that score was the diagnostic tool for us to confirm the child has malnutrition, covering the 3 levels of malnutrition: mild, moderate, and severe. After data collection, data was analyzed using APInfo version 7 with addition of multivariate analysis using 95% as a confidence interval. Of course, ethical approval was obtained from the ethical committee of the Ministry of Health, as well as permission and consent was obtained from the guardians or the parents of the children. The study has found that most of the respondents were living in IDPs, female were most of the respondents as well, and their age was about between 1 and 3 years most frequently. Interestingly, number of males showed that most of the respondents had 1 meal a day, only 1 meal a day, showing also as an increase in the range of severe acute malnutrition around the children, accounting for over 2/3 of the investigated children. Let's come to the parasitic infection. The parasitic infection was very high. Almost over 80% of the children had at least one parasite. Ascaris lumbricoides was the most frequent parasite we have seen, followed by Aegypti. Most of the children had only single parasite, but some had double and some had multiple. After analyzing the association, those variables had a significant association with intestinal parasite infection. With the multivariate analysis, age and meal frequency has been found to have significant association with parasitic infection. Having more than 1 meal brought the child to a risk for the infection. This is very important point, showing that our children are either not having enough meal or having wasted, overleft, diseased, or unsanitated food. If you don't have a meal, you will get severe acute malnutrition, and if you have more meal, you are at risk for intestinal parasite infection, which shows sanitation, environment protection, livestock protection, veterinary and agriculture is needed to work collaboratively to produce a solution for what we have in front of us. The study showed a high prevalence, over 80% of the children were infected with intestinal parasites, being Ascaris lumbricoides the highest organism we have seen on the investigation. Deworming has been the golden standard or the best approach for preventing or stopping the burden of the disease, but not only deworming can do anything. We need sanitation, we need safe livestock, we need healthy food, healthy nutrition for our children to overcome the problem on hand. Thank you all.
Investigation further and to understand this tick-borne disease. And it also acknowledges the interconnectedness, animal health with human health and environment also contribute when it comes to this under the One Health framework. Lastly, I would like to acknowledge all my colleagues just to make this happen with freelancer. Thank you.